Welcome to Facebook. I am our Facebook Live of healthywoman.org. I am Dr. Sharon Alisonati, and certainly on behalf of Healthy Women, I am absolutely delighted to welcome you to today's Facebook Live event, Bleeding Disorders in Women. Could you, yes, you be at risk, you and another woman that you know. So tell your friends, invite others to this Facebook Live right now. This is the first in a two-part series. And this focus today is really on navigating a diagnosis. Again, please share on your page, and help us continue to seek, find, and educate women so we can all be healthy. It's important to know that although bleeding disorders are not widely recognized in women as in men, they do occur. And while women and men have similar symptoms, women can experience additional complications throughout our lifetime. That's why it's really critical that we as women know the symptoms, get a diagnosis, and take the steps to get treatment. And now someone is saying, well, bleeding disorders, well, women have periods or whatever. That's really not all that we're talking about. So when we talk about purely bleeding disorders, we're talking about men versus women and some specific disorders. Our panel of esteemed experts will provide guidance on risk factors, recognizing signs and symptoms, and getting the care that you need. As well as always, healthywomen.org is talking to women, telling us, teaching us, pulling us, saying take an active role in your treatment and your care. We hope that you will use the question and answer feature to ask our panelists your questions. You hardly ever will have this great of a panelist ready and willing and able to answer your questions. No question is too small. No question is too complicated. Well, unless you're asking me, but anyway, we will do our best to answer certainly as many as we can. And we want to keep this very upbeat because knowledge is power and education is empowering. So I want to start by thanking the National Hemophilia Foundation for their support in helping us bring this important series to life. And remember, this is part one of part two of a two-part series. And now it is my pleasure to introduce our esteemed panelists. First, we're going to introduce Dr. Charlita Ayers. She is an associate professor of the Department of OBGYN, Obstetrics, Gynecology, and Reproductive Services at Rutgers University at the Robert Wood Johnson Medical School of New Brunswick, New Jersey. Dr. Ayers is also vice chair of clinical services for the Department of OBGYN and Reproductive Sciences. She is also the general division director for her department and program director for the Urban and Global Scholars Program. Welcome, Dr. Ayers.
Thank you.
Next we have Dr. Mira Chitler, professor of pediatrics at Central Michigan University, and please correct me if I messed up your name, and Barnhart-Lucia Hemostasis Research Endowed Chair at Wayne State University. And she is a director of the Hemophilia Treatment Center and the Jean M. Lusher Special Coagulation Laboratory at Children's Hospital of Michigan. You know she's an expert because that is one heck of a title. Oh, I got through it though. Okay, next we have Patricia Garrity, a nurse practitioner with over 20 years of experience in women's health. Ms. Garrity is currently Director of Women's Health in a multidisciplinary practice in Walnut Creek, California. She speaks and publishes nationally on topics pertinent to women's health. Dr. Chitler, hello.
Thank you very much for that very kind introduction, and hello and good morning, everyone.
Ms. Garrity, hello.
Good morning. I'm so happy to be here.
Thank you all for joining us. And I want to save as much time as possible for engagement with our audience. So now I would ask you all to kind of, in a nutshell, tell us what bleeding disorders are in general.
So bleeding disorder essentially refers to any condition where the blood is unable to make a proper clot to stop bleeding. So this could be for various reasons. We have lots of processes that actually have to play together in order for bleeding to stop and for us not to bleed more than we need to. So we have proteins in the blood that help make a blood clot. We also have cells in the blood that are involved in the process of clotting or stopping bleeding. So a deficiency or dysfunction of any of these proteins or the platelets or the cells, which are involved in this process, can result in a bleeding disorder.
Okay. Now, I want Dr. Chitler, because of all of the information out there on blood clots due to COVID, now you're saying that you actually want blood to clot. Other people are saying, oh, blood clots are deadly. Just in one quick sentence, just hit that so that our viewers will understand.
So we want blood to clot when we need to stop bleeding, but we do not want blood to clot when it's just flowing in the body in the normal state. Okay, so there could be situations like COVID where there's a lot of inflammation in the body that makes these proteins become hyperactive and make blood clots in places or in situations where we don't actually need, where we're not bleeding, but we're still clotting. So that's the bad clotting that you're referring to that happens in patients who have COVID or any other inflammatory state. Whereas if I fall down and hurt myself and I have a cut, I want my blood to clot in that spot so that I can prevent bleeding or stop bleeding. And so those are we want blood to clot when we need it, but we also want it to stop when it's done with that process and not clot when we don't need it. So we're very particular how we want our things.
Right. Ms. Garrity, tell me, what are the different types? And certainly you can talk about the bleeding disorders in general, but what are the different types of bleeding disorders? You and Dr. Ayers can chime in on this, please.
Well, I'm, as a nurse practitioner in a community setting, I'm sort of the front line when women come to me complaining or reporting heavy bleeding. I'm going to look at the multitude of causes, particularly when we're talking about heavy menstrual periods. There's a number of different causes, of which bleeding disorders are one of them. And perhaps the most common bleeding disorder in women is called von Willebrand disease. When we look at the general population of women, about 1% to 3% of women will have a bleeding disorder. But when we look at women who come in and say, I have heavy periods, in one study, that was about 16% of that population had a bleeding disorder. So that's 1 in 8 women. It's something that needs to be explored early on. Yet there was a study done in the United States where they looked at women presenting with heavy periods, and the diagnosis of bleeding disorder, 16%, it wasn't age related, as many women were newly diagnosed 20 years and younger as they were diagnosed 44 years and older. Oh, wow. So it's something that I'm so happy to be talking to women directly today, because women, we all discussed, women push healthcare, and you will push your healthcare providers to consider this as a diagnosis.
Okay.
And I think that's a very good point where we're saying, bleeding disorders. But, when women present to me as an OBGYN, they're presenting because they have abnormal bleeding. And yes, bleeding disorder is one reason why, and that's why we're here today to talk about it. But there's so many other reasons that women will have abnormal bleeding in an OBGYN setting with very heavy or heavier bleeding than they would expect. Affecting their quality of life, as a matter of fact. And those things could be anything from thyroid disease can cause abnormal bleeding, to fibroids, structural things such as fibroids or polyps can cause abnormal uterine bleeding. Sometimes even medication. Someone might be on a certain medication, and we'll find out that the medication is too much, or they're taking it too frequently, and they will bleed from that. So the reason why I bring that up is because as we're talking about this, we just don't want you to think that just because you're having heavy bleeding, it's a bleeding disorder. But we do say that as women, when you do have a problem such as heavy bleeding, it's something you should talk to your healthcare provider about.
Excellent. And Dr. Chitler, what is a bleeding episode?
So bleeding episode essentially refers to a situation where you're bleeding more than you should. And so, and usually also maybe in places where you shouldn't be. And so that's what we mean by a bleeding episode. But a bleeding episode can be anything. I know we've talked about women in particular and talked about heavy periods. But you have to remember that we also can have little girls who have a bleeding disorder. And so they haven't had periods yet. So their symptoms may be completely different from the older or the post-menarchal population that we just talked about. So having nosebleeds is, it's okay to have a nosebleed. People have nosebleeds. If you have allergies, sometimes that can cause some inflammation of the mucous membrane that lines your nose, and you can have nosebleeds from that. But having nosebleeds that last longer than 15 minutes is not usually normal. If you have to do something to get it to stop, that's not usually normal. And so bruising, having really large bruises, often women come to my office or mothers come to my office and tell me, you know, if somebody holds my hand tight, I can see fingerprints on my hand. That's not normal. So those are symptoms that are not necessarily what you expect to see in a normal person. And those should be indications that you should be thinking about a bleeding disorder. But a bleeding episode, when I talk about that, usually it's a very long nosebleed, a nosebleed that lasts longer than 15 minutes. Or if I have bleeding into a joint space, which shouldn't be there. So my knee is swollen or my ankle is swollen because there's actually blood in that joint space. So that's a bleeding episode. And so those are the kinds of situations that we would refer to as bleeding episodes.
Good, good. Now, Ms. Garrity, how do you diagnose these bleeding disorders?
So the first thing when a woman presents with bleeding is I want to know about her history. Again, as a gynecology women's health specialist, I am focusing not as much on nosebleeds, but I'll certainly ask about that. Do you have easy bruising? Have you had nosebleeds? Do you bleed a lot when you have dental care? I'll also ask about if there's an obstetric history. She's had a baby. Did you bleed a lot when you had that baby? And have your periods always been heavy? Now, that isn't perhaps as sensitive because, as we discussed already, a lot of different things can cause heavy bleeding. And sometimes it's the interaction of an underlying bleeding disorder with changes in hormones as life goes on, or perhaps a growing fibroid, that she finally presents with it. Family history. Do your sisters have heavy periods, your mothers, your aunts? And that's something I don't know that I've ever had a woman be able to tell me her family history at a first appointment. We don't talk to each other about that. And sometimes when it's an inherited bleeding disorder, everyone in the family has heavy periods and they don't recognize it as abnormal. So that's something. Then I want to know her bleeding history. And some of the real salient questions that I find useful is when you're having your period, do you have to get up at night to change your protection? You know, you're soaking through even heavier protection at night and needing to change. Are you missing school because of heavy bleeding if it's a younger, or missing work if it's an older woman? And so that's the beginning, talking to the patient. And if she answers yes to those questions, then we move on to laboratory testing to look for a bleeding disorder.
So Dr. Ayers, as I listened to this, we have talked a lot in the past with healthywoman.org, and you can't talk to women, particularly minority women, about bleeding and fibroids and all of that without having this discussed. And so when Ms. Garrity is talking about bleeding through, I hear women with fibroids say, you know, they're having massive bleeding. So two-part question, has an OBGYN looking at this from your perspective, how do you decide, is this a bleeding disorder or is this a genetic bleeding disorder? As Dr. Chitler, the hematologist, was talking about, or is this a functional one? And how do you find the right healthcare provider in this case?
Very good questions. And I think as an OBGYN and also as a woman of color, that becomes a really good question for women who have had this heavy bleeding before. So what is normal, what's abnormal? I think that's where you start off from. And I think we talked a lot about that. But one of the questions that has come out, and as we've done research, is the word flooding. Not many women will use that word, but when a woman says, I feel like does it feel like a flood? They were like, yes, that's exactly what it feels like. That's a little different. And also asking how often are you changing on your heaviest day? Because we know that if you're changing your pad or tampon greater than every hour, even every 2 hours for greater than 2 days, that's not normal. And I think a lot, the research has shown that we determine what's normal by our female family members. So if it was really a genetic abnormality and all of our family members are heavy, that is going to be considered normal for them. But so then you really have to ask those in-depth questions. How often are you changing your pad or your tampon? Is it flooding? When you're saying that you're passing clots, how large are they? So we use some people use a quarter. Are they bigger than a quarter? Some people say bigger than 2 grapes. I don't like using food, but so I use a quarter. So if it's bigger than a quarter and you're doing it repetitively, that is abnormal. It was very funny. Dr. Bachman and I did a study with one of our hematologists to look at women who had fibroids and bleeding and then had them being tested. And the other question also that came up where we saw that it was statistically significant, more women had bleeding disorders if you ask this question, do you ever wear white in the summertime? Those bleeding disorder women will never, ever wear white because of the flooding, because they don't know how much bleeding they're going to do during that whole time. And the other question is, how long is their period? If it's greater than 7 days. Greater than 7 days, bleeding more than changing pad every hour, or flooding, those 3 things are putting my antenna up that might be a little bit more than just someone having heavy periods. So those are the people that I will then refer to my hematology colleagues. The other thing that I think is also important is if ever someone needed a blood transfusion because of their heavy periods, or they get severely anemic, normally our body, if we have a normal period, can replace that iron that we need in order to produce those new blood cells. So your blood count might come down a little bit, but it won't come down to the point where it's so low that you get severely fatigued, tired, or possibly needing of iron supplementations. That's also a warning sign as well that I have. I mean, there might be other causes. And I also asked, like my colleague asked about the bruising, I asked those other questions as well, and then try to put it together. And if they start having a lot of those checkpoints, their bruising, the heavy bleeding, the needing of iron supplementation, I say, you know what, this might be a little bit more. Let's send you to a hematologist. So that comes to your second question, like, who should you see? I think your internal medicine, your family practitioner, your nurse practitioner, your OBGYN. If you're having bleeding or abnormality, I think seeing your primary care provider, whoever that may be, would be your first step. And for our younger colleagues, because we're talking about women and girls, the pediatrician. And after that, and you being assessed, then you really need to be seen by a hematologist. And the hematologist, and I think bleeding disorders is special. You need a team approach. And we're going to keep telling you, we're going to keep saying that throughout this whole Facebook hour. It's a team approach. But the hematologist is the real one who would further evaluate you and test you appropriately.
Excellent. And Dr. Chitler has a hematologist, and a hematologist is a specialist in blood cells. Hematology is the study of blood. Okay. So let's just get that straight. But would you agree your primary care physician is the first gate? So women that are listening, or men that are listening, who want to send their significant others or their daughters, they should first be assessed by primary care, including OBGYN. Would you agree? Okay.
I completely agree with that. I think that's the best approach that you can have. I think it's important for everyone to first recognize, when should I take my child, or when should I go to the doctor to be seen, right? So if you look at all of these symptoms that we've just talked about, long nosebleeds, easy bruising, or bleeding when you brush your teeth, or if the dentist cleans your teeth and says, you know what, you bleed more than usual, or if you've had surgery and had bleeding after that. And for women and girls specifically, of course, heavy periods, like Dr. Ayers just said, look at all those points. How long do my periods last? Do I pass clots? Do I need to keep a change of clothes in my kid's school, in the locker? That's very often I hear kids that say, I always
Wow.
have a change of clothes in my locker because I know that I'm going to have to come home otherwise. And so they don't want to miss school, so they keep a change of clothes. Or I often have moms say, I just keep her home because she bleeds so much. So we're missing 2 or 3 days of school every month, which is not acceptable. And so I think those are things that we all need to be aware of and looking. And if we see those symptoms, please go to your doctor, go to your pediatrician, go to your internal medicine doctor, go to your nurse practitioner and say, I have these problems and I think I need to be evaluated. And I think Dr. Ayers made such a good point that often our reference point is the mother or the aunt or the other women in the family. And so all the women in the family, look around yourself, look at yourself and look at others. And if you see any of these signs, you should be going to your doctor to make sure that you get assessed.
I really do teach a lot and talk a lot to public audiences. And I say this, and I'm saying this now on this Facebook Live. We're getting ready to have Thanksgiving. And instead of sitting around the table gossiping about who don't look like who and all this other stuff and who got put out or who whatever, who's cheating, who's getting a divorce, let's have a discussion about what runs in our family. Let's have a real discussion about bleeding disorders, about, I'm known as Dr. Sharon, let's keep it real. So let's have a real discussion about, well, okay, Auntie, well, how are your period? How were your periods? Or do you get nosebleeds, etc.? We do have a question from our Facebook Live. I had one doctor tell me, Mindy Norman says, I had one doctor tell me I have von Willebrand disease, but then another doctor say I don't have it, but can't explain why I bruise so much. If I test positive once, is it possible that I do not have it?
Okay, that's a really, really excellent question. And von Willebrand's disease is one of those sometimes difficult to diagnose diseases because the levels of your protein can go up and down often with normal, simple things like stress. So it is quite possible that the first time around when your numbers were low, that they were real. And the next time around, because you were stressed out or they had trouble getting your blood, that also causes stress inside the body, that raises the levels of the protein, pushes it up enough where it might come into the normal range. So often we have to test multiple times in order to be able to establish a diagnosis. And so I would say if you have bleeding symptoms, and there's a question about von Willebrand's disease, I would make sure that it's tested again or go to a hematologist. There are several reasons these tests can come back a little bit off. And so you need to make sure that the tests are run right and the person who's reading those results knows how to interpret them.
Excellent. I'm learning something. I'm an internist and geriatrician, and I just learned something. So I love doing these talks. Keep your questions coming. Here's one more question. Ms. Garrity, if you can answer this, how do bleeding disorders affect you at the dentist? I think Dr. Ayers said something about a dentist. How do they affect you?
Yeah, yes. And I want to just also chime in the importance of a hematologist, because we've spoken of von Willebrand's disease, but there are other clotting disorders, bleeding disorders that are more subtle, and I wouldn't have a clue how to begin testing. So if I, even with a negative test, and I once had a young girl who was phobic of needles, and so she was always stressed out when we were testing her blood. So that's a hematology referral. In the dentist, it's not unusual to have some bleeding when you're having your teeth cleaned, but if the hygienist or the dentist comments, wow, you're bleeding a lot, that is, I think we tend to have like this internal guilt going about our teeth. I haven't taken care of them well enough. But I would say move a step beyond that and say, no, I'm bleeding a lot. And yes, I do get fingerprint bruises and I do get this. And broach with your healthcare provider or mom, if you're a young girl, maybe I should get tested. One of the things about the family history that normalizing heavy bleeding is there was a study done in India where they asked women, do you have heavy menstrual periods? And 5% of the women said they did. But then when they went through an examination, in fact, it was 3 times that number. So I talk at Thanksgiving with your family, but also I believe in girlfriend power, okay?
Oh, yes.
Talk, if you have a girlfriend that's missing things because of her periods, talk to her about it.
Excellent. Now, this is excellent. Dr. Ayers and Dr. Chitler, what are some of the treatment options for just hit it and quit it? What are some of the treatment options for bleeding disorders?
Well, I'll start and then I'll leave for my colleague hematologist to get into the more advanced treatments. So for us as an OBGYN, women's health specialist, we would say for bleeding, I would start with, monitoring and having them just chart their bleeding first to see how heavy. And then we've used Motrin to try to see if that helps, because sometimes it does if it's mild. The other thing is a lot of women heard of oral contraceptives, the pill, and we've given the pill to try to decrease the amount of bleeding women have. We found too, even in younger adolescents, is the hormonal IUD has been very beneficial and has helped us a lot regarding some women who have really heavy bleeding, and it has slowed the bleeding. And in some women, their bleeding has stopped because of the direct hormonal effect inside of the cavity of your uterus. Has been helpful. We've used the estrogen ring sometimes for some women who feel comfortable with it. I don't feel as comfortable with that as sometimes, because if some of my heavy bleeders feel as though that's just too much to insert the ring during every month because of the heaviness of bleeding, but that has worked for certain women. And then other hormonal treatments by oral hormones that we've given, such as progesterone only type of medication pills to try to stop the bleeding, just to give women enough time so that they can bring their blood counts back up. And usually as we're trying to decide what's really happening with them, we don't want them to continue to bleed. So those are some of the things that I've used. Now, if they need more than that, I'll refer them to our hematologist. We maintain that, but I say, if we're doing this hormonal treatment and you're still having this low, more anemia or losing blood and it's not working, let's move on to the next phase.
Excellent. And Dr. Chitler, that's a nice lead in for you.
Yes, that is a very nice lead in. So I think the treatment of a bleeding disorder really depends on the type of bleeding disorder and the severity of the bleeding disorder, to put it very simply. So although there may not be a cure, the treatment can really stop and control the bleeding and prevent complications that you get from the bleeding. Okay. So if you're missing a protein, often we refer to these proteins as factors. And so there's lots by numbers, all the way from 1 to 13, and then you have 1 Willebrand protein also. So these are all the proteins that are involved. And so if a protein is missing, the best way to take care of it is to replace the protein that you're missing. Unfortunately, it's not that easy because it's not a pill that I swallow. Often many of these are IV treatments that have to be given. And sometimes we may not necessarily have just that protein by itself available, in which case I would have to get what is called plasma. But the treatment really should be determined by your hematologist, because they know which protein you're missing, how often you need to take this, and do you really need to take this? And we get away by doing other things. Sometimes we can use other medications like anti-fibrinolytics. So people might have heard of the term Amicar or the name Amicar or Lystida. These are medicines that help to strengthen the clot and just keep it in place. And that also works quite well for management of bleeding. And so these actually are pills, so they're easy to take. And so that can be done often even for management of heavy periods by itself instead of using hormones. So this is an option or an alternative that we have that we can try in the younger kids sometimes, or even older people. It works quite well. If it's a platelet problem, obviously these are cells that are involved in the process of stopping bleeding. And if your platelets don't work well, or if you don't have enough, you could have bleeding. In these situations, most of the time we can use the Amicar or the Lystheta that I just talked about, and that is usually helpful in controlling the bleeding. But sometimes, depending on the severity of the bleeding, we may have to think of other options. So it can get kind of complicated, but I think the point I'm trying to make is it's very specific to your type of bleeding disorder and really needs to be addressed specifically for you by your doctor.
And
Now,
I
I
think
want to jump in because there's a big medical school word that we need to break down. Platelets. In a sentence, what is a platelet?
So the platelet is a cell. So in our blood, we have 3 different kinds of cells. We have white blood cells that help protect us from infections. We have red blood cells that carry the oxygen around, give it to all the organs. And then we have the platelets. These are the smallest of the cells, but they play the most important role in trying to stop bleeding. And so they come to the spot wherever there's a hole in the skin and try to plug it up and stop the bleeding. And if they don't do that, then we end up with bleeding.
I call it the glue.
It is perfect. It's the glue.
The glue. Now, I have one question. I know, Dr. Ayers, you wanted to jump in, but I have one question that I just want to hit because I want to make sure we talked about von Willebrand's. We've talked about uterine bleeding and all of that. Ms. Garrity, are there other types? We know that there's hemophilia and all of that. Are there other types? If we were the top 5 bleeding disorders, I just want to make sure that we put it out there.
Well, and as Dr. Chitter said, that the factor deficiencies.
Yes.
Any of those factors that are missing, and the factor deficiency that you have particularly tends to, because these are inheritable disorders, they can occur what we call de novo. They can occur just brand new in an individual. Factor 11 deficiency, factor 5 deficiency, factor 7 deficiency, factor 8 deficiency, all of these different deficiencies need to be tested for specifically. Okay. And that's why a woman who presents with every check mark of heavy bleeding, even if I get nothing on an initial lab test, the hemophilia referral is essential.
Dr. Ayers, you wanted to jump in a few minutes ago.
Well, I want to add to that, and also platelet dysfunction, because I think, with the bleeding disorders, a lot of us, some of our colleagues forget that, as well as don't report that. But in women, platelet dysfunctions is a huge area too, along with the von Willebrand's disorder. But as we talk about types, I think it's and treatments, it's really important that what I get concerned about is sometimes we tend to treat before we diagnose. And with bleeding disorders, sometimes by harping on the treatment, you can affect the underlying evaluation to the diagnosis. So it's, and all of us who are on this panel, we've talked about this, is so important, if we can put anything out there, is to be evaluated fully and appropriately. Because a lot of times, even though we can send, as a primary care provider, I can send someone out for some of these testing, our hematologists have access to sometimes different labs that are specific for bleeding disorders. And our hematologists might want to get into that, hemophilia treatment centers, who have access to special types of abilities so that they can test appropriately. And I think we brought that up before. So it's so, so important that even though we're talking about treatment, that someone gets, diagnosed, because we've seen, all of us seen, unfortunately, patients who've been treated so much, but they've never really been diagnosed with what really is the underlying problem. And what's very funny, or it's not funny, but it can occur, is when you diagnose that one person, especially if it's genetic related. I've had one person that I took care of, a mom, and we found out her daughter, her mother, and her sister all had a factor deficiency just by her being diagnosed. So it's so important, if we can put anything out there, is appropriate diagnosis.
I just echo that. And I will say, your Google does not equal our MD or our advanced training or our PhD, whatever. Now, everybody's a scientist now, and you will go put these in, and now you are now pseudo doctor, whoever, trying to take care of you and your family. Sidebar, go see a physician and go see a specialist. Because, you know, I joke about that, but you can see Ms. Garrity, Dr. Ayers are all saying, yes, we are experts in our field. I'm an expert in my field, but some stuff you don't know. And some stuff Google doesn't know. I'm just saying. Okay, we have a ton of questions, so I'm going to deviate to make sure we get to these questions. Mary, and again, we're going to be as concise as possible. Are bleeding disorders more common in women than men? We answered this a little bit earlier, but as a general rule, are they more common in men than women than men?
So I don't think you can say that they're more common in women than men, but women have more opportunities to bleed because they're having a period every month. And so that's one of the reasons why we have a lot more women diagnosed with von Willebrand's disease than you see in men. And so if you looked at prevalence, maybe yes, that is true, but I don't think you can say that it's more common in women.
Now, Ms. Garrity, can you donate blood if you have a bleeding disorder?
You know what? I'm going to pass that question to Dr. Chitter. Okay.
Yeah.
See, that's a good example of saying, I know a lot, but let's go to the specialist.
So no, if you actually have a factor deficiency or you have a platelet dysfunction, it is not a good idea to donate blood, because I think the person that's going to get that blood is going to have some problems, and you yourself might have some problems. And so it would not be advised that you donate blood.
Now, this is different than you have heavy periods and you may be anemic a little bit sometimes, and they don't like, this is different. Yes. So now if you were anemic in your 30s and now you're 60 years old and you're not anemic anymore, don't use that 30s thing about my blood is low. Okay. So excellent. Excellent. Now, I have a question from myself that I want to make sure that we hit. We have focused a lot on uterine bleeding in women. What other sites under the skin, what other sites, if you were to talk about other sites of bleeding outside of the obvious in the uterus, where else would you see kind of the blood manifest itself, or that it would cause you worry?
Okay, I can answer that question. So I think you can see bleeding anywhere in the body. Okay, so when we talked about bleeding episodes earlier, sometimes us as doctors, we classify, or when we talk to our patients, we classify the bleeding as major and minor. Okay, so when we say major bleeding, we're referring to bleeding that could be life-threatening. And so typically there are some organs that obviously can't take much, and one of them happens to be the brain. It's in a very close space. There's not much room there. So even a little bit of extra anything can cause significant problems there. And so any intracranial bleeding is considered a major bleeding episode. There are other organs like the neck, for example, the chest and the belly. These are spaces where I cannot put pressure to stop bleeding. And I may not be able to see the bleeding either. So bleeding into these areas are also considered major bleeding episodes. Okay. And so you can also bleed into muscle, you can bleed into joints, you can bleed underneath the skin. And so you can also have bleeding in the mouth. We talked about teeth. Tooth extractions are another good test sometimes to say if you have a bleeding disorder. So if you bleed after a tooth extraction, that's not normal. So even if they pull out your wisdom tooth, there should not be excessive bleeding. So if you bleed after tooth extraction, that could be an indication that you need to be evaluated for a bleeding disorder. So bleeding can occur in any of the body parts, and some of them can be more serious than others are.
Because blood goes everywhere. So basically that's what you're saying, blood goes everywhere. Dr. Ayers, can people, and this is from Facebook, can people with bleeding disorders exercise and play sports, and what precautions should be taken? And any of the panelists can jump in with that. Hit it and quit it.
Well, you know what, as an OBGYN, I would refer to their hematologist to answer that question for them, because it would really be based on what type of bleeding disorder they have, how severe that bleeding disorder is. And I think that's the reason why it's so important. Like, we're putting it all together, but again, we have to say that you need to be diagnosed regarding it specifically which one you have. So I'm gonna let my hematology colleague follow up on that.
So there are definitely some sports that we do not allow our patients who have a diagnosis of a bleeding disorder play. And the ones that we absolutely say no to are hockey, football, wrestling, and boxing. Okay, so those are four sports that we that we anticipate are associated with a significant risk of trauma to the head or the brain. And therefore, we do not think it is safe for patients who have a diagnosis of a bleeding disorder to be playing those sports. We have come to a point now where we have reasonable amount of treatment for patients with hemophilia, which is a factor 8 deficiency or a 9 deficiency or 11 deficiency, A, B, and C. And so those patients we can treat on a regular basis. So we can try to prevent bleeding and keep ahead of the game. And so we can allow our patients to play sports now. We allow them to play soccer. We allow them to play basketball. We just can't let them go to the NBA or the NFL level, but at school they can play. Okay. So I think as long as you're treating on a regular basis, you should be able to pursue some of the sporting activities. But whatever I tell my patients, I think I just want you to be smart. Think about it before you choose a sport. Think about what is the danger to me if I get into this sport. I wouldn't, even if I played baseball, I wouldn't want to be the catcher. The ball's coming to me at 90 miles an hour. That's not a good position to play with a bleeding disorder. And so even within the sports, you have to think about it. When we talk about soccer, or we say you can't play goalie because the ball is going to come flying at your head most of the time. And so there may be some positions we don't allow our patients to play. So what we say is contact sports are not a good thing for patients who have bleeding disorders. Okay.
And common sense.
Yes, a lot of common sense.
A lot of common sense. We have a ton of questions coming in. Keep them coming. Now, Ms. Garrity, is it normal to still spot and have monthly periods at the age of 58?
Okay, that's a little bit off of bleeding disorders, but in general, the answer to that is no. The definition of menopause is 12 months without menstrual period, and the median age or normal age of menopause varies tremendously among populations. In the United States and North America, it's about 51 years old, but in India, it's 46 to 47 years old, much younger. So a woman who is still having bleeding, and women tend to think I'm bleeding, it's my period, when actually there are other reasons that can cause bleeding and none of them too great to have, still bleeding and spotting at 58 absolutely needs a workup. I wouldn't put bleeding disorder at the top of my list of what's likely to be going on there, but we definitely need to explore what is happening.
Dr. Ayers, I want you to just hit that question a little, but I also have a question from Taylor, which is another OBGYN question that every woman would ask. So we talked about the bleeding at 58. I usually say in my talks about menstrual period and menopause, I usually say in Proverbs, it says something about as a mother is her daughter. And so I tell women to ask their mother when they went through menopause, because we know about a year onset of starting your period and ending your period may mimic that of your mother. So if you could just hit that. But two, Taylor asked, how heavy is too heavy? What if your heavy periods are taken care of by birth control? Is this still a problem? Woo.
Well, that's a good question. And I think, Taylor, thank you for that question, because even if it is controlled by the birth control pill, I would say if your periods were greater than 7 days with changing your pad every hour, that I still believe you should be worked up. And the reason for that is recently ACOG added one other risk factor for you to evaluate for us as women's health professionals to evaluate someone for bleeding disorder, and that's for postpartum hemorrhage. That if someone has had heavy bleeding after delivery of a baby with having greater than almost a liter of blood loss or needing blood transfusion, that woman probably needs to be evaluated. And so I would try to, even though you're controlled during the time that you're not pregnant, I would still say that that person needs to be tested. The one caveat is that sometimes on birth control, it can be a problem with testing. And that's the reason why I always tell people that we need to collaborate. When we have that a light bulb go off that you even think that someone is a bleeding disorder patient, we need to get the whole team together to say, okay, I think this person needs to be evaluated, so you can evaluate and treat along the same path. But I think, you know, anyone who's having, even though it's controlled, I would say that that's great. But if you notice that you need to change medication or it's not working anymore, I think that will be a time to be evaluated.
And
I'd like to add to that.
go ahead.
So one thing I'd like to add is you have to remember that, yes, you have your periods are controlled with whatever hormones that you're taking, but that may not necessarily mean that you're okay to have major surgery, or that may not necessarily mean that you're okay if you were in a major accident. So I tell patients often, why do you need to know about your diagnosis if your bleeding symptoms are not so severe? Many times parents will say, how does it matter? She only bruises. So yes, but if you have a bleeding disorder and your bruising is related to the bleeding disorder and tomorrow you need brain surgery, you definitely do not want to have brain surgery without knowing that you have a bleeding disorder, because that is going to be a major risk for complications. So I think there are several implications to the diagnosis of a bleeding disorder. We can appropriately take care of you for surgeries. We can appropriately take care of you if you're in a major accident. So beyond the normal daily routine activities, there are other situations where this diagnosis would be very important for your proper management. So it is important for you to get that diagnosis in place. And that's where Dr. Ayers was saying that, you know, instead of just starting the pill and taking care of the periods, it's important to understand why your periods are heavy so that you can go beyond that step and take care of the rest of the stuff. And then again, I want to say, if you have a bleeding disorder and you have a child, you'd want to know what is the risk that this child can have the bleeding disorder.
Yes.
Right? And if this is hemophilia and you're a carrier, then your son has a 50-50 chance that he is going to have hemophilia. And you do not want to have that circumcision done without knowing if this child has hemophilia.
Excellent. I want to interrupt you for 1 second, Dr. Chitler, because Francesca asked the thing. I was going to come back to you with this question. If I have hemophilia, will my child definitely have it?
Okay, so if you are a carrier or have hemophilia, so you have to remember that hemophilia is carried on the X chromosome, and every female has 2 X chromosomes. So you will have 1 affected chromosome if you're a carrier. And so you have a 50-50 chance with every pregnancy that the boy is going to have hemophilia or that the girl is going to be a carrier.
Excellent, excellent. And remember, just Facebook Live, I know y'all are smart, but I'm not as smart. XY is
boy.
XX is
Girl.
Okay, those are just your chromosomes. Now, that's it. You were going to say something, Ms. Garrity, and I cut you off.
Well, that's okay. I just wanted to add to the fact of sometimes we jump ahead because pediatricians see a lot of girls, adolescents with heavy menstrual bleeding, and OBGYN see a lot of perimenopausal women with heavy menstrual bleeding. If we put you on a hormonal IUD or birth control pills, that won't control the other sources of bleeding in a bleeding disorder.
Excellent. That's excellent. Now, we are talking about a team approach. If you all on Facebook, whoever you're watching this on record, if you don't hear anything else, Dr. Ayers started it off and Ms. Garrity and everybody has said, team approach. You should have that no matter what, a team approach, okay? So now, as women, we often kind of only see this type of specialist, whatever, but it is a team, and keep your follow-up appointments. You can go to a restaurant. Now with COVID pandemic, you can go see your doctor. That's a sidebar. Now, one question that is key, Dr. Chitler, is what if I live in an area where there are no specialists? Is there somewhere I can access a hematologist virtually?
That's an excellent question. Now, there are specialized centers called hemophilia treatment centers where hematologists who specialize in the care of patients with bleeding disorders are there. So my recommendation would be to find the closest hemophilia treatment center to the city where you live, and you should be able to call that center and reach a hematologist who is there. So often a hemophilia treatment center sometimes will actually cover multiple states, especially states which are sparsely populated. And so they will virtually take care of patients very often. Unfortunately, the testing cannot be done virtually.
Right.
That would still require you to see the doctor. But once you have a diagnosis established and you have established a relationship with the physician, they should be able to help you virtually in many situations.
Excellent. Now, more questions are coming. Keep them coming as we got to wind down. Okay, so since women with bleeding disorders have pain during their menstrual period that can be severe, what are some suggestions to manage this? And I'm actually going to couple this with the next question from Sophia, who says, why can't women with bleeding disorders take aspirin or non-steroidals? And is Tylenol a good option? Y'all jump in.
Yes.
I'll start off, and then we'll go around again as a team. But yes, you'll see that a lot of times you'll have bleeding disorder. People with heavy bleeding with bleeding disorders have a severe cramping. So one of the things that I do is I try to treat the bleeding first, and do that in multiple ways, either with the birth control pill or with the Mirena IUD. You have to be careful regarding also with certain medications though, because sometimes you can make them worse, and we'll have our hematologist talk to you about that as well. Heat also helps with discomfort, with cramping. And I think we forget some of the things that we can do locally. Local heat, warm heat, moist heat also has helped a lot of my patients as well.
And exercise also helps. Women who exercise, you change your neuronal activity, you change your endorphins. And so the uterus might still be cramping away and bleeding away, but less of those messages are getting through to the part of your conscious part of your brain that says this hurts.
Yet another reason to exercise. Didn't you all need that? I need it.
So exercise also drives up the levels of your von Willebrand protein. And so patients who have mild von Willebrand disease can actually make their bleeding symptoms better by keeping on a regular exercise regimen, because then you'll drive your levels up, and hopefully that should help control some of the bleeding. So now I'd like to address the second question about why can't I take aspirin? So aspirin, Motrin, and non-steroidal anti-inflammatory drugs actually prevent your platelets from working well. And so if I already have a factor deficiency, or I already have a problem with my platelets, adding a drug like aspirin or Motrin can make my bleeding symptoms worse, because now I've disabled all of the stuff that helps take care of my making a clot. And so that is one reason why we tell our patients that you should not take aspirin or Motrin without actually talking to your doctor. There are some other types of medications, the COX-2 inhibitors, that maybe we can use, but aspirin and Motrin are usually contraindicated in patients who have a bleeding disorder.
Excellent. Okay, we're going to push through these last few questions, and we're still getting questions, which is great because people need to be empowered with great information. And I just want to give out a shout out to Girl Power. All of these wonderful, fabulous women who are specialists in the sciences. Okay, I just thought I'd add that. Now, quick question, yes or no, and it's never yes or no. Does having a bleeding disorder put me at special risk for infection? And I think now in this age of COVID, we have to add in, she didn't, but I will, COVID. Should I alter my day-to-day activities?
So far, from the studies that have been done, they have not found an increased risk for patients who have a bleeding disorder. They've looked at all of the patients who had bleeding disorders and hemophilia and tried to see if they had a higher risk for COVID. And no, we haven't found that. Occasionally, patients or especially younger children with bleeding disorders will have what we call central lines or IV line that is put into the patient in order for us to be able to give them the factor that they need on a regular basis. When that happens, we are now introducing a foreign body into your body that increases your risk for infection. But this is sort of different from the COVID type infection. But generally, patients with bleeding disorders should not have an increased risk for infection unless you have an immune system problem that is in conjunction with your bleeding disorder. They're very rare platelet disorders that have immune deficiency associated with them, but that's for another day.
So quick question, this is a yes or no. From Cynthia, one of our viewers, can my blood disorder be cured? I know the answer, but we're gonna let y'all say, can my blood disorder be cured? And we already talked about lab tests, which is the other part of her question.
So we don't actually have a cure at this time for bleeding disorders. We have methods to help control the bleeding and make your symptoms better. And I don't know what the question was regarding laboratory tests.
Oh, you already hit it. Some lab tests, they basically go to the hematologist and the hematologist will do the lab test, but they ask what lab test should I ask for?
Yeah, I think you should see your doctor. The doctor has to, a good history is probably the best way for the doctor to decide what lab tests need to be done. So
now, I'm glad you all are great. You just lead into my questions. When a good history, and all of us have talked about that a bit. There's a question that says, what are the signs I might have a bleeding disorder? When and what should I ask my doctor about? Now, remember that question, but I want you to put it in the phrasing of when patients come to your office to talk about bleeding, about their symptoms, what do you recommend they prepare? What should they bring? How should they deal with this? So this would be from each of your perspective very quickly.
I'm going to jump in real quick because we're running short, but I really want her to bring a menstrual tracker with her. And all of my 47-year-old patients, I tell them to go home and talk to their teenage daughter about how to learn how to do their menstrual tracking, but I really want that. I want them to perhaps ask anyone who's done surgery on them, did I bleed heavily? It may not be information that's spontaneously shared because the clinician is thinking what went wrong here without thinking maybe the patient had a bleeding disorder. And I want her to bring her family history. So if you're suspecting you have a bleeding disorder, make that appointment. It might be a wait to get in to see someone, but in the meantime, call mom, call sister, call aunt, and find out, what were your periods like? Did you have bleeding around surgical procedures or childbirth? So menstrual tracker, family history, and a good report.
Okay.
I'll just add on to that regarding the menstrual tracker. If you don't have a menstrual tracker, what am I really looking for is how often you're bleeding each, in between the first day of your period to the next. How long are you having that period? And on your heaviest day, how often are you changing that pattern tampon? So those are the questions that I would ask you as well.
So there's one app out there that actually collects that information on the app itself, and it's called Sisterhood.
Oh.
And so it's free, it's downloadable, and it'll download on both iPhones and Androids. And it actually allows you to put in this kind of information. It asks you, what kind of pads do you use? Do you use super pads? Do you use regular pads? Do you use tampons? Do you double up? Do you pass a clot, and how big is it? So I think that's a good app. If you can get that would be the best. So usually when the patient comes to see me, I have them downloaded in my clinic before they leave. So that way, when they come back, I can take a look at the numbers.
And I really like apps. The only caution I give, because we're on Facebook Live, is for adolescents. Some of those apps, you just need to have parent guidance, because they also ask some really sensitive questions on there regarding sexual activity, other things. And sometimes it's shared. The community is shared, and you just want to be careful for our young, very young tweens. when we're using the app. So I recommend the apps for adults, and I think it's great. It's just for my tweens, I still use paper just because of that. And there's some newer apps that are coming out there are the parent can control it much better.
Excellent.
So this particular app, though, I must add there that it's actually individual. You can't share it. It's not a group thing. I know what the apps that Dr. Ayers is talking about, but this particular one is just like it's sort of a patient diary almost. So it does help.
Excellent. Okay. We have been talking about bleeding disorders in women, and I don't know about you all, I've learned a lot. And I, from my perspective, I'm going to ask each of the panelists to just in 30 seconds, not even a minute, to wrap up this. But I will start and say, if I had to tell a person anything about health as an internist and geriatrician, even with bleeding disorders, I would say, we talked about what to take to the doctor's office, but I would say what I usually say for all of my Facebook Lives with healthy women. Number one, don't leave the doctor's office without some answers, whether it's the OBGYN or the hematologist or the internist. What is my main problem? This is called Ask Me 3. I push it all the time. What's my main problem? Well, I'm bleeding more than I should. Why is it important? Because you could pass out if you bleed too much, and it could be life-threatening. And 3, what am I going to do about it? And your OBGYN, your internist may say, I'm going to send you to a hematologist. A hematologist may have another route. But what's my main problem? Why is it important to me? And what do I do about it? In any aspect of medicine, you should be engaged in your care and do all the other things that you can do to help yourself. Ms. Garrity, you're going to start us off, followed by Dr. Ayers and by Dr. Chitler. Half a minute to 45 seconds. If you have a parting word to say to our very engaged viewers today and those that will watch later.
So thank you. Thanks for letting me be part of this. It was a privilege. I would say what I say about all healthcare with women is know how to tell your story. Today's discussion has given you a lot of really important phraseology, important words, important parts of your story that if you're including, how often am I changing my protection? How often do I get up at night to change my protection? How long has this been going on? What hasn't worked to help this get better? Those are the things that will trigger the red flags in your clinician's mind. To say, don't try to go in with a diagnosis. Do try to go in with your story very clear.
I want to say this has been a great time for me too, and I'm learning as well as the sharing. I think the one thing I would share is be your biggest advocate. You need to advocate for yourself. And I think I found that advocation has really assisted with me assisting my patient when they advocate for themselves and bringing in that information. The second thing I think is family history. I think I really appreciate when we discuss that family history is, I think, one of the things that a lot of my patients aren't aware of until I bring it up. And then they have to pause and say, I really need to ask that question. I think that's one of the aspects that we're learning more and more of, getting that family history so that we can better able, as clinicians, be able to better take care of you as that individual, taking in your family history as part of your history for the future of your health as well.
And Dr. Chitler?
Thank you so much for having me today. It's been a wonderful opportunity, and there's a couple parting remarks I'd like to make. One is, of course, that you have to be your own advocate. That's a wonderful thing. Second thing, let's take away the taboo that's associated with talking about periods. It's a bodily function, and why do we have to keep it such a secret? I don't think it should be anymore. We've got to, girl power. We got to do this. We got to make it go away. And the third thing I want to say is anemia is a symptom. It's not a disease. If you're anemic, please talk to your doctor and ask, why am I anemic? It's like saying, I'm going to take Motrin and the fever's going to go away, but you need to find out where the fever's coming from. Similarly, why are you anemic? Sometimes that can get you to the underlying problem, and you need to take care of the bleeding disorder that's causing you to be anemic. So thank you again. It was a wonderful opportunity today, and I hope we helped everybody.
I'm sure you did. And anemia is low blood count, low red blood count,
That's
right? And many doctors and OBGYNs, particularly and internists, will tell you that you are anemic. Excellent. Now, in closing, and on behalf of Healthy Women, I want to thank all of you on today. Wasn't this good? This was good and engaging. Thank you, the panelists and the participants, for your great questions and your participation on today. Again, on this Facebook Live, you can repost it, share it, and all of that. I invite you to join us again on November 17th at 12 p.m. for the second installment in our series of focusing. And that series, at this time, we will focus on living with a blood disorder. And once again, thank you to the National Hemophilia Foundation for their support, which helped make this possible. For more information, you can go where healthy women go for great info that is vetted, that is good, that is not Bubba telling you some crazy stuff. Healthywomen.org. This information is so vital that we get credible information. And go to hemophilia.org, has good sites to get information. Thank you so much. This was a ball. Thank you all for having me.